Hi everyone, welcome to our channel. My name is Zetu. Today, I would like us to talk about the journey of the patient in the operating theater. What happens to the patient while he's admitted in theater? I know some of us have been into operating theater, but for those guys that hasn't been into operating theater, and I would like to talk to them and so that they know what to expect. As a patient, once you are booked for surgery, you will be admitted into the hospital. On the day of the operation, the patient will be taken to operating theater accompanied by the ward nurse. On arrival to operating theater, the theater nurse will be ready waiting to admit or to receive the patient. The ward nurse will do the endorsement or handover to the theater nurse to ensure the continuity of care of that patient. Before they do any endorsement, the identification of the patient will be done. When the patient is going to theater, he will be having an ID band that will be having the name, the surname, the medical number of the patient, and the date of birth. Now, the two nurses, including the patient, will identify the patient. Patient will be asked to identify himself while the theater nurse is checking on the identification band. Once the identification is over, and they will continue with the other requirements. All this is done to ensure that is the correct patient, is the correct surgery that is going to be performed. It is going to be performed onto the correct site or site. They will continue with another requirements. One of them, it will be the consent. They will check the consent or informed consent. The consent needs to be complete. Each and every patient that comes into the operating theater needs to come with the consent. Informed consent is a legal document that has been given by the patient after he has been informed about the operation, the advantages of the operations, the alternative that can be done, the risk and complication, and all that needs to be informed, and the surgeon needs to tell the patient about the operation, and even if the risk and complication, the patient needs to know, because it is the patient's right to know what can go wrong. And from there, they will continue doing the checking the allergies. If the patient is allergic to any medication, it will be noted onto the patient's documents. The patient will be wearing an allergy band so that each and everyone that will be working with that patient knows what the patient is allergic to. The physical assessment of the patient will be done. They will check whether the patient is not coming with any jewelry. If the patient is having false teeth, is the false teeth removed? Are any clips on the hair are removed? And they will check the site where the patient is going to be operated. is the site clean? Is the site free from any infection? If the patient is going to be operated on the limb, it can be the leg, it can be the arm, it can be any part of the body, and that area needs to be marked. When you are marking the area, let's say the patient is going to be operated on the leg, that leg needs to be marked where the operation is marked. On marking the area, you're supposed to use a permanent ink that it will not come out even if the area has been cleaned with the cleaning lotion, to ensure that the marking is always there until the team start operating on the patient. Once all the requirements that are necessary when admitting the patient, the ward nurse will sign with the theatre nurse that he has handed over to theatre nurse, and then the theatre nurse will remain with the patient right through. There are quite a lot of people that are involved in the care of one patient in theatre. There is a team, which is a surgical team, there is anesthesia team, and there is nursing team. And once the patient is in the waiting area or holding area of theatre, the surgeon will come and greet the patient. Although the surgeon has been working with the patient, but on the day of the operation, he will also come before the surgery and greet the patient and make sure that the patient is comfortable and is ready for surgery. The anesthetist will also come and greet the patient and find out if the patient wants to ask any questions, that the patient will be given that chance. And then once all the team, meaning the surgical, anesthesia, and the nursing team are there, they will do the verification of the patient as per patient safety checklist. And the verification, the first verification that will be done, it will be sign in. Sign in. It's when all the team that are going to be working with the patient, they will re-identify the patient, talk about the patient, find out whether everything that is needed for that operation is available. Once everybody is happy, then the patient will be taken into theatre, and then the patient will be put to sleep. After the patient has been anesthetized, before starting the operation or before cutting, they will clean and drape the patient, and then they will call for time out. Again, is the final verification before they could cut, where the team will introduce themselves, the anesthesia team, the surgical team, and the nursing staff. The question will be also asked. They will discuss about the patient. They will discuss roughly how long the operation can be, if there's a possibility that they may need blood. All that information pertaining to safety of the patient will be discussed, and make sure that all the things that they need for the operation is there in theatre and it's ready to be used. And then the operation will start. Once the operation is finished, before leaving the operating room, another verification again, which is the sign out. On the sign out process, the surgeon will actually mention what operation he has performed, if there was any specimen that has been taken, how that how he wants that specimen to be handled. The anesthesia is the same thing. If there was any problem, if there was none, and then you will also mention if there was any allergies while the patient was asleep. If he has any event that has happened, he will also mention. And same thing with the nursing staff. They will also verify that everything is correct, surgical count is correct, and everybody will be happy. Once the operation is finished, cleaned, draped, the patient will be transferred to recovery room if the patient was booked to be transferred to recovery room. It does happen that the patient is going to be transferred to ICU. If the patient is going to be transferred to ICU, the patient straight from the operating room will be transferred by the team and handed over into ICU staff. If the patient is transferred into recovery room, the team will also hand over the patient into recovery room staff. The recovery room staff will receive the patient. They will monitor the patient. It depends on the patient. Some patients can be in recovery room for an hour. It can be 2 hours, depending on the complexity of the operation. But once the patient is fully awake, the anesthetist will sign and check the patient again that the patient is ready to be transferred to the ward. The recovery room nurse will phone the ward staff to come and fetch the patient, and the recovery room nurse will hand over to the ward staff, and the patient will still be monitored in the ward. If you do like these short videos, please subscribe, please share and comment so that we know what we can talk about next time. Thank you for watching. Till next time, stay safe and stay